function of the nose, it's to breathe, obviously, right? But what if you struggle to breathe? We are going to help you with that today. Dr. Ward is here with me. Dr. Ward, all about the nose today, and we want to focus because people who struggle to breathe, whether it's at night, during the day, you can actually fix that.
Right. So we always think about the nose as like front and center of our face.
Yeah.
You know, the most prominent structure, but it's also like the first thing that we breathe through. You know, like one of the most essential functions of our body is to breathe. And there are so many people who struggle with breathing, and it's, you know, whether they really can't breathe at all or they're just having to work a lot harder to get the airflow in. That's something that we as facial plastic surgeons take care of to help improve.
So tell me this, when you say they're working harder to breathe, would we know that? Is it something that's obvious, or is it something that we might have grown up with and we have no clue if we're struggling to breathe and working harder than normal?
Both.
Okay.
So it could be something that you're just born with. In fact, here's an interesting statistic. About 7% of natural childbirths are associated with enough nasal trauma to fracture the nose.
Interesting.
Cause problems, which I mean kind of makes sense, right? But
yeah.
But so you could just be born with it. It could be genetics. It could be trauma. You know, like your sister elbowed you when you were 7 or something, and you have a hard time breathing.
Ever since.
But it's really just, there's people who are just working a lot harder than the average person to breathe. So whether that's, oh my gosh, I can't work out because I have to work so hard, I have to breathe through my mouth all the time.
Got it.
It's important to have kind of natural airflow through the nose so you can kind of breathe normally, and that's what we do. Of course, we affect the appearance of the nose in many cases, but we also want to improve the function. You know, we want it to work right.
Yeah, so that was my next question. How do these procedures work? Some can obviously be more invasive than others, but walk us through just a couple options.
So there's really two broad categories of issues that can happen when people have a hard time breathing through the nose. There's kind of the issues with the lining of the nose. So think about like you have a cold, the tissue, the tissues inside the nose swell up, or you have allergies, same sort of thing. The thing that we're talking about primarily though is structural issues, where there's actually the opening to the nose just isn't wide enough, or the passageway isn't wide enough to allow proper airflow. So that might be the septum, which is the cartilage and bone that separates the two sides of the nose from each other. Or it could be the side of the nose here, then what we refer to as the nasal valve, that could be kind of collapsing and we need to give it a little bit more strength. Or it could be these little things called the turbinates that stick in from the side of the nose to help humidify and warm up the air that we breathe. But in some cases they're too big. And if they're too big, then you can't breathe.
Okay, so you can look at the nose, figure out which one is affecting that person, or do sometimes people have multiple? Or is
Typically
it usually
multiple.
one? Okay.
Typically multiple, and a lot of people that I see as a facial plastic surgeon may have tried other things like a single treatment. And it's usually multifactorial, you know, like, so it's about 40% the septum, 45% the nasal valve, and then the remainder is the turbinates.
Interesting. So it's something that you can actually go and look at and then fix. And these procedures, if somebody is thinking about it, it's obviously something they're going to have to take some time off of work, right? Like you said, it's the most prominent feature, but what kind of downtime are they looking at?
So if we're just kind of working on the inside of the nose, probably about a week.
Okay.
You know, a little bit longer. Not going to be fully recovered at 2 or 3 weeks, but pretty darn close to it.
And I think some people too, I know a couple of people that have had these situations, and some people get a better nose.
They do.
In the instance too, they get the nose that they actually want,
right,
for appearance wise.
Right. So insurance will typically, not always, but typically pay for surgery that will improve the function of the nose, you know, to help it breathe better. They will not pay for things to do with the appearance of the nose.
True. But if it's going to make you feel better, you do you. You go for it. So, Dr. Ward, you do a lot of things. I mean, we're talking, things that are obviously more procedure oriented, but you do as simple as Botox and a lot of things that you offer to give people confidence.
Right. And that's exactly what I believe facial plastic surgery is about, is improving people's confidence, helping them live their life. And if part of that confidence is being able to work out better, breathe better with improving the function of the nose, that's great. If it's looking better, that's great too.
All of it, all of the above. Thank you so much, Dr. Ward.
Thanks.